Hi, thank you, Fjola, for joining me today to come talk to me, sorry, about your latest paper. It's looking at different cardiac troponins and their association with OSA. So first, if you can perhaps just give us a little introduction to yourself, so sort of who you are, what your background is, and where you're currently working.
Yeah, sure. My name is Fjola Sigurdardottir, and I'm a medical doctor and a researcher at the Department of Cardiology at Akershus University Hospital in Norway. And I'm both part of a sleep, heart, and respiration group at Akershus University Hospital and a cardiothoracic research group. I just recently defended my PhD thesis on common sleep disorders and cardiovascular biomarkers in general population.
Oh, great. Well, congratulations. Onto your study. So as I said, it's looking at cardiac troponins and their association with oxygen desaturation in OSA patients. So first, could you just give us a bit of an idea of sort of what you were looking at and why you were looking at that?
What we were interested in looking at in this paper was to look at novel desaturation parameters, because we need more or better parameters of obstructive sleep apnea to predict adverse outcomes. So what we did was to use cardiac troponins as a surrogate endpoint to kind of or look at the association between these novel desaturation parameters and the troponins, and see whether these new parameters for obstructive sleep apnea were any better than the apnea-hypopnea index in kind of predicting higher subclinical myocardial injury.
Yeah, and just to sort of emphasize that the troponins are a marker then of the cardiac injury. So it's a way of seeing the effect of the OSA and the desaturations on sort of heart injury.
Yeah.
Cardiac injury.
And cardiac troponins are very sensitive and specific markers of myocardial injury. So most clinicians maybe know them from the diagnosis of acute myocardial infarction, but we're not talking about those levels here. We're talking about lower levels that still predict adverse outcomes and cardiovascular disease.
Okay, great. So then if we can then go on to the study. So if you can just tell us sort of who you were looking at and what you sort of did within that population.
Yeah, that's a great question. So we use data from the Akershus sleep apnea study, which is a cross-sectional two-phase study in Akershus County here in Norway. Basically, we looked at the individuals that were included in the sleep analysis of the study. They were first screened with a questionnaire, but there was almost 30,000 people. But this was 535 participants that were then taken into a clinical study, and those that had valid sleep measurements or cardiac troponin measurements were included in the current study. So 498 participants.
Okay. And so then for your study, what were you looking at specifically within those people?
We were basically looking at these new, or we rescored all the polysomnographies for novel desaturation parameters. And we wanted to compare, first of all, we wanted to see whether the new obstructive sleep apnea parameters were associated with cardiac troponins, because we know from previous studies that there have been reported associations between apnea-hypopnea index and cardiac troponins. And our group has looked at that in this population before, but we wanted to first look at these novel parameters, and then we wanted to compare these novel parameters with the apnea-hypopnea index and see if there was any difference in how well they predicted higher subclinical myocardial injury.
Okay, great. So what did you find then?
Yeah, so we found that these novel markers were associated with cardiac troponin I. So two cardiac troponins that we looked at, cardiac troponin I and cardiac troponin T. But although they were associated with cardiac troponin T also in unadjusted models, they were not associated with that in adjusted models. But these novel parameters were comparable but not superior to the apnea-hypopnea index in predicting subclinical myocardial injury. So there was no difference in the ability of these obstructive sleep apnea markers to predict myocardial injury in this study.
Okay. And so what do you think then is the kind of take-home message from this? Like, what can you sort of use this for, or what's the next steps in the research?
I mean, I think new parameters of obstructive sleep apnea severity are exciting, and we need to kind of dig more into that, and whether it's desaturation severity or hypoxic burden, to try to look at what obstructive sleep apnea parameters best predict adverse outcomes or cardiovascular disease risk. But it's at least good to know that the desaturation severity parameters were no different from the apnea-hypopnea index. But we'll need to see whether, for example, they predict over a period of time. We have collected another sample of the same participants many years after, where we have new polysomnographies and new blood samples. So we will be looking into that in addition to looking at the desaturation parameters and outcomes. So overall mortality and major adverse cardiovascular events. So that is kind of the next steps.
Okay, great. Well, thank you so much for giving us a little oversight of your paper. And thanks for talking to us today. And good luck with your future research.
Thank you so much.
Thanks.